I am pleased to welcome back Dr. Robert Kolts. Dr. Kolts is the clinical director of Overjet, and Overjet is one of the leaders in the field of artificial intelligence in dentistry. He has a dental degree from Minnesota and an MBA from Penn State. He's an experienced executive in the DSO industry, and his passion is to develop systems to maximize operational and clinical efficiencies while maintaining exceptional clinical outcome. He's a busy guy at Overjet. He coaches executives and providers on the adoption and usage of artificial intelligence. I know here in our clinic, we have the Overjet software, and he's been really helpful in as we test it out. And we have really found some great clinical possibilities. So I'm really anxious to have Dr. Kolts back, and his lecture today is Enhancing Patient Care with AI. Dr. Kolts, it is all yours.
Amazing. Thank you so much, Dr. Park. Thank you to the Glidewell team for having me back. This is actually a follow-up, and let me share my screen here, to a presentation that I gave, I think earlier in the spring. And so I'm excited to be able to dive a little bit deeper today. There will be a couple of review items just for audience members who maybe didn't catch the first presentation. But what I wanted to focus on today is not so much, what is AI, although I'll give you a little introduction to how our models are trained, because I think it's really helpful to understand that, to be able to appreciate what you're going to see. But really what I want to dive into today is how can you implement AI in your practice? And so Dr. Park mentioned I've got a lot of experience coaching and working with large enterprise organizations on implementation. I don't want to go that direction. Today, what I want to focus on is your individual practice and give you some practical tips of ways that you can use artificial intelligence in your practice. So not talking about 400 practices, talking about your 4 operatories, how this can make a difference. So this is me. Dr. Park did a great introduction, so I'm going to skip over this. I think the relevant information here is I'm a clinical dentist. I'm a general dentist for almost the entirety of my career. I've maintained a clinical practice. And so I know the challenges that we as clinicians face in our operatories. I recognize the challenge for any hygienist who may be on of the limited time that we have in our operatory. I recognize the challenge of getting our patients to accept treatment, of running a business while you're also providing the primary service and generating the revenue for your practice while also trying to do good and just have your patients have a good experience. And so that's the level that I want to speak to. I want to speak to the clinician down at the solo practice. And so just for a moment, I want you to do a little exercise with me. I want you to take a look at this radiograph, and I want you just to think in your mind, what do you see here? Okay, does this patient have any carious lesions? Does this patient have any calculus? Does this patient have any restorations that have recurrent caries or are failing? This exercise is what we as clinicians go through dozens, if not hundreds of times a day for every single x-ray that we take in our practice. We are responsible as the dentist in the practice to review every radiograph, provide an accurate diagnosis, come up with a treatment plan for our patients, maybe multiple treatment plans, present that treatment. Some of us present financial, some of us have team members that help do that, all while maintaining busy practices where we have multiple columns of restorative treatment, multiple hygiene columns, and we're expected to do this accurately and not miss anything because there's liability involved and patient outcomes involved. And so now I want you to have that experience, and I want to overlay artificial intelligence over the top of it. Now, looking at one image, this may not have just blown your world. This may not have changed drastically what you saw on this one x-ray, but I want you to do that same exercise now. Do you see caries on this radiograph? Do you see failing restorations? Does this patient have bone loss or calculus? Okay. Artificial intelligence is not coming up with a diagnosis for you. I think that we need to make clear. Artificial intelligence is going to help you as a clinician become more confident, more precise, more accurate as you're reviewing these radiographs, and ultimately communicate that more clearly to our patients. And so for today, we'll do just a brief review of how the artificial intelligence works, how the models are trained. We'll review a couple of case studies and really help show you how this is being used in clinical practice. We will really discover the 4 areas in your practice where artificial intelligence is going to be most impactful. And there's lots of flavors of artificial intelligence out there. There's numerous companies out there. Some are we show you an X-ray only, and some are more encompassing and have analytics and reporting and wider integration. So I'm going to show you how some of that can be effective. And then I want to talk a little bit about what's coming next in AI, how what it's doing now is impactful, but really what's coming down the road and how it's going to impact you. That's a lot to fit in the next 25, 30 minutes, but we'll do our best here to not go too fast for you. So artificial intelligence works by reviewing a radiograph that it's never seen before and applying artificial intelligence models to that image. And so models is a set of algorithms or data points that the artificial intelligence uses to review an image and come up with an output. And so what you're seeing here on the right is a radiograph that's been annotated by artificial intelligence. It's gone through about a dozen different machine learning models, and each model recognizes something differently. So there's one model that may recognize caries, one that recognizes existing restorations, root canal obturations, CEJ points, bone points, calculus, all of those things that we as clinicians learned in a more holistic view in dental school. There's a separate model for each one of those items. And so we can apply those models to the X-ray, then we can aggregate the output and overlay it on top of it. Now, the way that the models are actually trained, though, is that we have to feed it a lot of data. And so let me show you an example. Okay, so this is the image that I had in my opening slide. It may surprise you, or maybe it won't, to know that I've never worn this suit. I have no idea where this photo is supposed to have been taken. This image was created entirely by artificial intelligence. I think it did a pretty good job of recreating me, although I think in life my biceps are much bigger, so we'll blame the AI for this photo. But this image completely created by artificial intelligence. And how was this image created? Well, what I did is I fed about 12 images to this software that ran this through the model development, and the AI began to recognize patterns in each of the images. So things like my hairstyle, my facial structure, my pose, the cant of my eyebrows as I stand in the photos. And then from that 12 images that I fed it, it came up with what it thought would be a good headshot for me. It actually did a decent job. I showed this to my wife and it confused her. She was trying to figure out where or when I would have worn a suit like this. And only later did she realize, once I told her, that was not an actual real photograph. So really impressive what it can do with just 12 photos. Okay. Now, if I had fed it 1,200 photos, it would have been much more photorealistic. But I think it is important to know, because there's a lot of this generative AI. This is what we call it. Generative AI, where the artificial intelligence is creating something out of essentially nothing. It's learned a lot, and then it creates new content. So this is like ChatGPT, these headshot programs, the image creation programs where you can write in a description and it'll create a brand new image based off of your description. Those are generative AI platforms, excuse me. The artificial intelligence that we're implementing in dentistry is not generative AI. What I mean by that is Overjet, the other AI platforms, are not creating caries or creating features on your X-rays that are not present there. They are descriptive. They are reviewing the X-ray and they're describing what they see. And the way that they do that, the learning is very similar to those generative AI programs. So what happens is, as we feed data into the models begin to recognize patterns in the data that we feed in. Okay. And it begins to create this artificial neural network. It's this own association. And the reason we do that is I can't really describe adequately using words or an algorithm where or what caries looks like on an X-ray. Okay. For example, if I wanted to teach the model to find a square, that would be easy. I would say find a closed shape with 4 90-degree angles and 4 sides that are the same. And if you find that, then you found a square. Okay? It's much harder to do that with something that's harder to describe. So let's use a non-dental example. Let's say I wanted to create an AI algorithm that would recognize if there was a dog in an image. Okay, well, how would I describe the dog if I was going to create an algorithm? I could say, well, there's ears, but they might be up or they might be down. There's a snout, but it might be long, it might be short. There's probably 4 legs. That one's probably a pretty safe bet, but it could have long hair, might have short hair, right? So there's all these descriptives that we would struggle to come up with in human language. And so we can feed data point after data point, and then the models are going to begin to recognize patterns out of all the data. Now, the challenge, though, is that you have to feed it so much data for it to recognize the patterns that you're going for. And so what we do in dentistry, to bring this back to the conversation at hand, is we use a supervised learning process. What that means is we feed annotated x-rays, so x-rays that have been annotated for whatever feature we're teaching the model. So let's say we're teaching the model to recognize caries. So we would have licensed dentists annotate where the caries is on the images, and then we would feed those annotated images through the models, and then the model would recognize patterns among our annotations. Okay, so that speeds up the learning process, so we don't have to feed it so much data, and it improves the accuracy of the models as we do that. But now what that means is we can take an x-ray that the model has never seen before, it'll run it through its models, its machine learning models, and then it'll generate an output. Now, what's important to recognize is what that output actually means. Okay, so what the AI is doing is it's annotating an x-ray in the way that it thinks a dentist would have annotated the x-ray. And I say it like that very specifically because what the AI is not telling you is where there is caries, right? What it is telling you is, hey, this is a dentist is very likely to have labeled this area here as a carious lesion. But this is AI. It doesn't know the bacterial etiology of caries. It doesn't know the process that leads to bone loss. It only knows what we've been teaching it. So the more we teach it, the smarter it will get, the more sensitive it'll get as we go through. But now we can get an x-ray that looks like this. And this can happen in near real time. So 90 seconds or less from the time you take an x-ray to the time it's uploaded to the cloud, annotated by a dozen models, aggregated and available to be viewed. Essentially, by the time you take the sensor out of the patient's mouth, wipe it down and set it to the side, the model, the image is there ready to be viewed. So we call that near real time. And now it's annotating existing fillings in blue. It's got caries highlighted here in yellow or red, depending on size. It's got boxes around calculus. It's got CEJ points and bone points measured and then labeled and then measured from those two spots with an accuracy of plus or minus 0.3 millimeters. Okay, and really what this lets us do is be able to observe and read this x-ray in a way that was never possible before. We're trying to bring a level of consistency and objectivity to the process. Objectivity and consistency between clinicians is one of the biggest challenges that we face in dentistry, especially if you're in an office with multiple providers. And that could be multiple dentists, that could be multiple hygienists, or you just have one dentist and one hygienist, and there's inconsistency in how the two of them interpret what they see on an x-ray. Now, we also bring objectivity into other radiographic interpretations. So, for example, we're able to detect third molars on a panoramic image, and we're able to detect which portion of the tooth appears to be below the crest of bone, and then we can calculate the percentage of impaction. So now as you're looking at degree of difficulty, possibly submitting for insurance claims and you want to submit a partial bony versus complete bony, now you have objective information as you're looking at this. And so this was a almost purely subjective process before. You would look at it and say, oh, this looks like it's over 50% impacted, so I'm going to say this is a complete bony impaction. Well, now you'll actually know the percentage with a very high degree of accuracy there. We also have models that can detect periapical radiolucencies, that can detect root canal obturations. And if you think long-term as you're using this, what impact could this have? This has the ability potentially to be able to recognize quality of an obturation, distance from the apex for a short or elongated fill, expelled sealer through the apex of the tooth, to determine size of an apical lesion, and then determine over time in a more objective fashion, is the size of that lesion changing within the constraints of angulation and things, of course. And so really, again, coming back to that accuracy and that consistency, this is one of the areas that I think AI is making the biggest impact for. When we talk about accuracy, there was a really interesting study that came out in 2019 that looked at the impact of time pressure on a dentist's ability to diagnose accurately on a radiograph. And it was really fascinating. What they did is they split the group of dentists into two cohorts. One of the cohorts had unlimited time. Look at this x-ray, come up with your diagnosis. The other cohort had a finite amount of time. So imagine like a countdown timer in the top corner of the screen, counting down 30 seconds. And after the timer hits 0, it goes to the next x-ray and you have to come up with your diagnosis. And what they found is that clinicians, when under time pressure, will diagnose 40% less radiographic caries than clinicians without time pressure. Okay, now that doesn't mean those are bad clinicians. In fact, these weren't even inexperienced clinicians. The average age of experience of this group of dentists was 17 years. Okay, so I would consider that a very experienced clinician. And now think in your own clinical practice, when is the last time you had a diagnostic experience? So you're doing an exam, limited exam, comp, or periodic, that was not under time pressure. I don't know if I've ever done one, except for maybe coming in on a Saturday for a patient who's having a toothache or something, right? Time pressure is the reality of what we do. We are constantly under time pressure. Okay, we've got multiple hygienists looking for exams in a short period of time with our own treatment waiting in our own columns. And so we're clinicians, we're humans, we try our best. And I think by and large, we do a quality diagnosis, but the reality is we do miss things. And so if there's a tool that can help us reduce the amount of error, the amount of non-detection on these radiographs, I think it's very impactful. And then if you look at that study, the impact on periodontal related findings, so your bone loss, your calculus, 67% less findings related to periodontal disease when under time pressure. Now that's could be for a couple of reasons. In my mind, it's probably because we're restorative dentists. And so if we have a limited amount of time, we're going to look for the restorative features first. So that's probably a big challenge there. But the reality is in every office that's out there, essentially, periodontal disease tends to be very underdiagnosed. Okay. So I think this is a big piece that plays into that. And if you extend this study maybe to a hygienist experience, right? Which of our hygienists are not under time pressure during their 40 to 60 minute long periodic exam and prophy appointment? So now let's get into how we can integrate artificial intelligence into your workflow. So just to kind of recap the workflow here, there's a utility that sits on a server that auto recognizes when x-rays are captured in your operatory. It syncs up to the cloud, annotates, and is available to be viewed in a Google Chrome tab. Okay, so that's a very seamless process. As far as the hygiene workflow, really the only change is that instead of viewing x-rays in your current x-ray viewer, unless there's an embed feature, then you'll just have a separate browser tab opened up with the annotated radiographs in them. Okay, and so now that you have that ability, it uploads seamlessly. How do you use it to be most effective? So what I want to talk about is what I like to call the 4 squares. It's the 4 most impactful areas in which you can implement artificial intelligence. So the first one is being chart preps, and I want to show you how AI can help simplify and save you time during chart preps. Second is facilitating communication during your morning huddle, making your morning huddles more impactful and more effective. The third, and the third is the area where most people think of when they think of AI, and that's looking at real-time findings. Okay, and then the fourth is using this as a patient communication tool. So we'll briefly highlight these 4 areas. I could turn any one of these squares into a full 90-minute lecture, so I'll try not to be too long-winded as we go. So chart preparations is a very important aspect of our auxiliary staff for our hygienists, our assistants, and even the doctors. Okay, now, hopefully in your practice, your team is already prepping charts to some degree. Okay, when we say chart preps, what we mean is you don't want to walk in and treat a patient. You don't want your hygienist to, you don't want your assistant to, and you as the dentist certainly don't want to walk in and not know something about that patient, their history, what you're doing that day. Okay, so chart preparations typically is a responsibility of hygienists and assistants as they're going through and they're determining, okay, what is this patient going to need today? So you might look for things like, do I need a perioprobe? Do I need to take radiographs? What was their chief complaint last time? What was the treatment that we diagnosed last time that didn't get scheduled? Is there any medical alerts or medical history related issues that I need to be aware of? Now, this tends to be a fairly time-consuming process. So in a lot of practices, this will happen the night before the day of appointments, or sometimes they'll come in early and do it the day of. There's some practices where this isn't happening, and so you're kind of feeling things out as you go. But really, there's a lot of information that you can automate using artificial intelligence. So for example, let me show you what we call the daily patients dashboard. Okay, so this is a representation of your day's schedule. It has every patient coming in for that day in order of time. It's got listed which operatory they're being seen in, what treatment they're scheduled for. It has a list of undiagnosed AI findings. So that's that list towards the right. And then it has a couple of boxes going across the top. And that's what I want to show you just for a minute. So here, what AI can do is we can auto-generate which of your patients are due for specific things. So for example, due for bite wings and due for perio charts. We can read the perio chart data. We sync with your patient management software, so we see the previous transactions. We sync with your x-ray platform, so we see which x-rays were taken recently. We have access to the periodontal charting, so we can see when the actual perio exam was taken. So we're not necessarily looking at the transactions for that. And then as your patients are coming in, we can call out which of those patients are due for those specific actions. And so now this probably saves your hygienist several minutes every day just hunting down that information. And if you think about your chart preps right now, the chart prep really means I'm going to go gather a bunch of data, right? And then as soon as I've gathered that data, I'm out of time. And so that was my chart preparation. What AI can do is it can turn the chart preparation from an information gathering exercise to an information analyzing exercise, because now you have the data and now you can determine, how do I provide more effective, higher quality care to my patients? And I'm not spending time doing the information gathering because we can automate that. The other piece that you can do with this is look at potentially undiagnosed treatment. So when we sync with your practice, for example, we'll pull 18 months of historical radiographs, and we'll pull your transactions for the last couple of years. And we can compare AI findings with what was treatment planned or transacted in your practices. And so now, instead of just showing you a couple of things that your patient needs for that day, we can give you insights into potential diagnostic opportunities that may have been missed or not captured previously on that patient. And so things like, this patient's coming in for a prophy, but they have bone loss and elevated probing depths, and we haven't treatment plan scaling and root planing. Maybe we should flag that patient as potentially needing periodontal therapy. And so this can be exceptionally impactful, because think about how your hygienist, or if you are a hygienist, how you have to get this information now. You're going to go through your 8 patients for the day. You're going to look at their x-rays at their bone levels. You're going to look at their probing depths, okay, which is in a separate area. You're going to determine, does this patient have adequate diagnostic information to diagnose periodontal disease? Is it something that I want a treatment plan? I'm going to have the doctor look at it. I'm going to have the front desk go, and I'm going to have them maybe start some financial arrangements. Well, now Overjet or your AI platform can automate that experience for you, so that information is aggregated. There's the recommendation generated. And so now you still need to clinically validate that recommendation. But now, as we get into the next section, which is morning huddles, this will facilitate the conversations that you can have there. So morning huddles, as I work with dental practices and groups, I find that morning huddles is one of the indicators of success that I see in a lot of practices. And if you're not having a morning huddle, I highly encourage you to consider having one. If you are having a morning huddle, then I highly encourage you to have a good morning huddle. With morning huddles, the purpose is a stand-up meeting at the start of every day to focus on what is happening that day. What is the communication that we need between departments? So between the hygienist and assistants and the doctor, between that team and the front desk. How do we provide a more consistent experience for our patients, a higher quality experience, and ultimately improve patient outcomes and patients' ability to accept treatment? And so really with AI and in your practice, the morning huddle preparation starts with your chart preps. So as you're prepping your charts, what you're really doing is you're getting that information and you're determining, what do I need to prioritize as far as communicating in a morning huddle. And so now, as you're improving and working on your morning huddle, that point number 3 there, which is come prepared for the morning huddle, artificial intelligence can make sure that you are prepared without having to spend a lot of time gathering that data. And then you can communicate things like, hey, Sally's coming in at 8. Looks like maybe we want to pivot and do scaling and root planning. So can you start the financial arrangements now? And then that way, when I have the conversation with her, we're ready to go. And maybe you can even do same day treatment. And so really that's the impact here of having artificial intelligence, is using it to facilitate and streamline those conversations. So real-time findings, I'll just touch on just real briefly. Real-time findings, again, this is when you think of AI in dentistry, this is what you're thinking of. I've got annotations, I've got caries and calculus and bone loss, and I'm going to draw it on an x-ray. Okay, it is a super impactful thing to do. It's got a lot of impact in helping us diagnose more accurately. Hopefully you're seeing, by this presentation, that there is more to the AI than just the annotation. And so if you have a platform, for example, that only annotates on an x-ray and you lose the analytics, you're going to lose some of the impact of that AI. But what we're finding is, as you incorporate the AI into your diagnostic process, it can really make a significant impact in your diagnosis. So I want to show you a case study. This was sent to us by a friend of ours who works for a large DSO, and had been using the Overjet platform for, I think, 2 months at this time. And he sent this example. If you look at the distal of 20, now that you've seen it with the annotations and without, it seems fairly obvious, at least to me. But he said, this is one, and he kind of swallowed his pride. He said, look, I missed it. I hadn't diagnosed anything. I had no intention of diagnosing anything. And then I said, oh yeah, let's pull it up with the AI and see what it looks like. And sure enough, there's a yellow annotation, which for Overjet, yellow is how we present it if it's incipient, meaning it's contained within the enamel. And to be honest, I think Overjet probably underestimated the size of this. I can see a little radiolucency through the DEJ there. And so I think, Overjet was even a little conservative in how it annotated it. But what he did then is he documented the process because he was like, okay, this helped me diagnose something. Let's see how this actually looks in the patient's mouth. And so here's his rough preparation. And you can see that sure enough, there's caries there. And absolutely, it's beyond the DEJ. Okay. And so then he went on to restore, then got a nice restorative outcome for his patient. But think of what happened if he hadn't diagnosed that. Would it have been the end of the world? No. Okay. Hopefully you would have caught it next time. But what do we know about the disease process for caries? Is that lesion going to get smaller? Definitely not when it's this size and it's beyond the DEJ already, right? In fact, sometimes it can spread quite large. It would have, in 6 months or 12 months when he was due for another X-ray, it would have at least been a larger restoration. Could have been a crown, could have been causing issues, symptoms, root canal, all those things. And so this is how we can provide higher quality of care for our patients. And so just for the sake of time, I'm gonna briefly kind of go through some of these couple of slides here. But there's also, not just on the restorative side, but on the periodontal disease detection, every X-ray, whether it's a PA or a bite wing, will have bone level measurements annotated. So on a bite wing, we'll show in millimeters. On a PA, will show as a percentage of bone loss. And then what you can do is you can use that information and we'll auto aggregate it with your periodontal probing depths to make recommendations for potential periodontal therapy. And again, for all of these detections, you are still the clinician. Artificial intelligence is artificial. We do get it wrong sometimes. We'll annotate things that maybe you'll validate clinically, say, no, I don't think there's caries there. And certainly that's your prerogative as a clinician to come up with the best diagnosis for your patients. And so the last thing I want to touch on here is just the way that this can also streamline some of your insurance submissions. So it may surprise you, or maybe by this point, maybe by this point it won't surprise you that artificial intelligence is used extensively by insurance payers. In fact, the majority of the payers, the top 10 payers at least, are using AI and specifically Overjet's artificial intelligence to automatically approve your claims. And what I mean by that is the X-rays that are being submitted are analyzed by artificial intelligence, and then they're able to apply objective criteria to those radiographs and to the information that you submit. So for example, every payer out there, whether they're using AI or not, requires evidence of radiographic bone loss in order to be able to approve a claim for scaling and root planing. Well, what is radiographic bone loss? What does that mean? Historically, the way it happened is you and your hygienist would look at an X-ray and say, hey, this looks like bone loss. And then you'd submit it. And then some percentage of the time, the clinicians, the reviewers at the payers would look at it and say, no, this doesn't look like bone loss. And then they deny the claim. And so then there's this kind of adversarial relationship that develops there. Well, now what you can have is an objective set of eyes looking at every radiograph. And it's the same set of eyes for your practice as it is for the payers. And so you can know objectively, again, with an accuracy of plus or minus 0.3 millimeters on a bite wing, what the bone level measurement is. And then you can apply some literature, best practices to it. We know that less than 2 millimeters from the CEJ to the crest of bone is considered biologically normal. And we know above 2 millimeters from the CEJ to bone is considered evidence of radiographic bone loss. And so payers, by and large, are using measurements right around that value to determine if it is radiographic bone loss. And so this happens automatically. If you submit an X-ray, there's evidence, they will automatically pay for, cut a check, send it, mail it, without human intervention ever happening. And only if it doesn't meet that minimum threshold would it get sent to their clinical review team to review to determine if they can automatically adjudicate that claim. And so the way this is primarily being used right now is for your crown codes, some third molar extractions, scaling and root planings. And again, this is happening whether or not your office is using AI, the payers are already applying this. And so you have the ability now, though, to be able to see the same AI findings that the payers are already seeing. Now, kind of the next step of where this is going to go is going to be faster pre-authorizations. And then really ultimately it's point of care adjudication. And we actually have a pilot going right now that we've done with a large DSO, one of the major payers. And we found that every SRP recommendation that was made by Overjet and submitted by the practice, 100% of them were paid by the payer. Okay. And so as we start to extend that more, eventually we could foresee a day where patients in the chair and you hit a button and you'll be able to get an automatic, hey, yes, this is approved by the payer. And that doesn't mean you should treat or shouldn't treat, right? But that means you can at least have better quality financial information for the patients so they have a better understanding of their financial implications. Because we all know the worst experience for a patient is being told it's going to get covered, and then they go home and they get a bill and they're upset about it. So that's really on the payer side where things are headed there. Now, as far as what's next, there's some really exciting developments coming down the pipeline. I think right now you'll notice everything is 2 dimensions. So I don't think I actually showed a PA, but we've got bite wings, we've got PAs, we've got panoramic images, and that's really where the AI has been focused. But we recognize that 2-dimensional radiographs obviously have limitations, and they actually represent a relatively small, maybe 20 to 30% of the information available in a patient's diagnostic experience. I mean, you have a whole patient sitting there in a chair that right now we don't have access to. But as we start to expand our ability to see, can we extend this to other modalities such as 3 dimensions? So can we look at intraoral scanning, CBCTs, and even intraoral photographs, which is 2 dimensions, but is a better representation of the 3rd dimension? And the answer is yes, you're going to see a lot of developments coming through 2024 that I think is really going to change how AI is applied in dentistry. And then, coming back maybe a little bit more to the bread and butter is pediatric caries detection. We're very proud of the fact that we have our pediatric caries detection models that should be wrapping up their approval here very soon. And then you'll be able to use this on models trained on primary mixed dentitions. And then the last piece, and this is probably the one that excites me the most, is how do we get more holistic and individualized in our recommendations? So right now, AI is very transactional. What I mean is you take an X-ray, AI reads it, comes up with a recommendation, shows you, there's a carious lesion, so you should do a restoration. Well, what if we could take other things into account? For example, what if this is an incipient lesion on a low caries risk individual? Right now, there's no determination of that in the artificial intelligence platform. But what we're looking at doing is expanding this so that we have access to, for example, your chart notes, the patient's medical history, their previous treatments, looking at their periodontal probing, aggregating that information and looking at it more like you as a clinician looks at this, right? So you don't look at an X-ray and use that as your sole determination if you're going to treat. You look at the patient in a more holistic fashion. So what you're going to start seeing is AI platforms such as Overjet start generating caries risk assessments, periodontal risk assessments, aggregating that information, and what may be recommended for one patient may not be recommended for another patient based off of other factors unique to that patient. And so with that, Dr. Park, I'm happy to take any questions if there were any. Otherwise, I can turn over to you for continuing.
We always have questions, Dr. Kolts. Yeah, we've got a pretty sophisticated audience, and they've got some really good questions for you. So, what you're showing us with Overjet depends a lot on the radiograph, and we all know that sometimes radiographs aren't perfect. Sometimes they've been elongated or shortened. How does the AI deal with those discrepancies in the radiographs?
Yeah, so it treats it very similar to how we as a clinician treat it, and we do our best, right? If I only have overlap contacts in all of the X-rays and I'm trying to see if there's a lesion in that contact, I really don't have the ability to determine that. And so the AI will try its best. We've specifically programmed the models to be less aggressive in overlap contacts, because what we don't want is false positives, because sometimes in overlap, everything looks like caries, right? So we programmed and reduced the threshold on those so that there's not as many false positives. I think really what you're getting at, though, is AI is going to highlight the need for quality X-rays rather than overcome the challenge of having poor quality X-rays.
Right. I mean, just as AI helps to standardize the findings, well, we kind of have to standardize the diagnostic information that's going into it as well. So, yeah.
Well, what's really interesting is one of a common feature request that I get from clinicians is, can you tell my hygienist for me that they need to retake an X-ray? I mean, that's a challenge. Dentists, we don't like telling our staff to redo things, right? Because we all know that that's not always a fun conversation. And so, can you please create something that'll tell them for me?
Right. No, that does take some tact. especially with a hygienist. I agree. The question that I got last time too was you're showing really good information associated with periapical radiography. What about panoramics? What about 3D, cone beam imaging, things like that? Are we ready to move our AI in with that?
So I think that's the next step that's being worked on right now. For panoramic images, we do tooth identification, we do third molar impaction detection. What we don't do right now is any pathology, your dentigerous cysts or melaloblastomas, things like that. The FDA hurdle to get approved for those models is significantly higher than caries or bone loss detection. So certainly we're working on it and interested in doing it. I think it's the time frame to turn that around is elongated. And then 3D is absolutely on our roadmap for 2024. As part of the roadmap planning a couple of months ago here at Overjet, and it's going to be a big part of the future here for Overjet.
I think that's a great idea. I mean, there's so much more information, especially like in an endodontic case. There's so much information in a 3D image, so that would be great. Interesting comment here. So one of our attendees, he tried a competitor to Overjet. It wasn't Overjet. It was another well-known company in this business, and he believed that it excessively diagnoses or overdiagnoses and would tend to like push treatment rather than really providing help in interproximal decay. It felt like it just basically overdiagnoses. And also in bone level measurement, as you said, well, just because there's more than 2 millimeters of space between the CEJ and the bone crest, that doesn't really mean that they need treatment. How would you respond to this observation?
Yeah, so I get complaints, both sides, that we are either too aggressive or we are too conservative. And the fact that I get both of those complaints almost equally tells me that here at Overjet, we're in like the sweet spot right now. So we are fairly conservative on our recommendations. Clinical conservatism is one of our like core founding principles. And what I mean by that is we would rather not show you something that we're not confident of rather than show you something falsely. And if you look at our FDA studies and look at our sensitivity and specificity, it's right in line with that as far as, our specificity is super high, our sensitivity is, closer to about 80%.
But
And,
what's the greater risk, Dr. Kolts? Is the greater risk for the AI to miss something or fail to diagnose it or to overdiagnose it?
well, I'm gonna correct your word choice just a little bit. Overjet AI does not diagnose anything, right? All we are is a highlighter for your X-rays. So really, if for me as I use this, I would rather have the dial turned up on being overly sensitive, so that I then am reviewing all those areas and making the determination if I want a treatment plan or not. The
Right.
reality is I don't think we are overly sensitive. I think we're, like I said, kind of right in the middle on sensitivity. But at the end of the day, this is trying to draw your attention to areas where it's like having 100 of your dentists give you their aggregated opinion on that x-ray. You don't have to agree with them, and a lot of times you won't, but at least is a conversation starter for you and for the patient.
Exactly. Okay, here's an interesting question. Hey, can I blame you guys if a misdiagnosis occurs?
If a misdiagnosis, so you're saying like you drop a box and there's no caries in there? I mean, the reality is like that. I don't know if you've practiced for any amount of time, that's happened to you already, right? You've dropped a box like, oh, I swear that looked like there's caries in there. Again, we're a findings tool. We're loops for your dental x-rays. So we're going to help you see more objectively and clearly. But at the end of the day, it's not going to make up for lack of good clinical judgment. So make sure you're still
Yeah,
x-rays.
and I would say just to kind of reiterate the way you corrected me, this AI doesn't diagnose anything and it doesn't make treatment plans, right? It
Correct.
helps you look at the information that you've provided, and then you're going to make the diagnosis and you're going to make the treatment plan. So yeah, I think that's well stated by you. You mentioned that some doctors think you're over pointing at things out, and others think you're under highlighting things. Is there a way to adjust the standard? Like if I'm a guy that I don't treat it until it hits the DEJ, that it won't point it out till that point? I mean, is there any adjustment available?
So there's no dial you can hit to like, okay, I want to be sensitivity 5 versus sensitivity 1. And I think it makes sense to not have that because we are FDA cleared models. All the models have shown that dentists are more effective diagnosing using the AI than not using the AI, to the tune of like it's close to like 20% more lesions will be detected by a dentist using AI than a dentist without. And I think what that speaks to actually is the fact that underdiagnosis is the epidemic in dentistry, not overdiagnosis in
Right.
general. Sure, there's some that may overdiagnose, but in general, it's much more underdiagnosis.
Okay. And specifically, and you mentioned like with impactions. Well, so now you have a percentage of it of bony impaction, and you can actually quote that to the insurance company when you're sending it in. What about for caries and periodontal disease? How do I use the information provided by Overjet to help me get paid for these procedures?
Yeah, so Overjet has an export feature. You can export the image with and without the findings on there. So when we train in office, for example, we'll train the front desk staff on how to do exactly that. For a tooth that you're doing a crown on it, Overjet will calculate the decayed, missing, or filled percentage of the individual crown on that tooth. So you'll know exactly what percentage of that tooth is impacted by disease process, limited to 2 dimensions, of course, and you'll be able to submit that. And that's the same value that payers are using to determine if they're going to automatically pay for that crown or not. So you're going to have access to that information, be able to export it. And even if it's a payer that's not using AI, which you don't always know, right? Because it is somewhat of a list filled with non-disclosure agreements. But you can still submit it. So we train staff to submit it for every claim that you send in for crowns, for your periodontal disease, to help you get paid. And we've got a lot of anecdotal feedback from those offices that they are seeing less denials, that they're seeing a better degree of accuracy on their diagnosis. And so then they're seeing a better payment on the back end with those findings.
So, Dr. Kolts, I have been a dentist for 44 years, and I come into this with a little bit of skepticism. And every time I hear about this, the more interesting it sounds, and the more it seems like it could really be a practical
I'm not hearing you, Dr.
aid.
Park.
You're not hearing me?
Oh, there we go. I'm sorry. It
Okay.
may have been me.
Oh, okay. That it can really be a valuable aid in the practice. If any of our people out here can they get a demonstration? I mean, without actually buying the software, is there a way they can get a demo where they could put one of their X-rays in and see what the Overjet AI, provides to them?
So we don't have a way on our website to do that, but certainly we've done that for individuals before. So really the best way is if you just go to overjet.com and just schedule a demo, they'll pull up the actual platform, walk you through. You can see exactly what it looks like on live clinic data. If there's an image of your own that you really want to see, you could shoot me an email. My engineers are going to hate me for saying this, but if you shoot me an email, I can work the engineer team, have them run it outside the platform.
Okay. It's really interesting. As I said, we have it in our clinic here, and I'm just really amazed. I have to say I didn't expect much, but every time I look at it, I'm just amazed. So this is great stuff, and I really appreciate you coming in as a practicing dentist and giving us a very, very practical look at how this can help. It's a great presentation. I learn a lot every time. So thank you, Dr. Kolts.
Thank you for having me.
Very good, and thanks for everyone for joining us today, and thanks to our panel. And we'll see you back next week when we'll have, as always, our business advisory panel. And our guest speaker will be Dr. Noemi Cruz Orcutt. And she is a private practitioner from Mason City, Iowa. And she's going to be talking about how to prepare your practice for an unforeseen crisis. And she has an amazing story to tell. So let's see you back here same time next week. And we'll have another great session. So thank you. Thanks, Dr. Kolts, Carrie Culpepper, Steve Pospisil, Gary Pritchard. Take care, everybody. Have a good week.